The adrenal gland does not produce sufficient amounts of the steroid hormones cortisol and, sometimes, aldosterone. 1. It is an autoimmune disease which affects some genetically predisposed people in whom the body's own immune system has started to target the adrenal glands. 7. In many adult cases it is unclear what has triggered the onset of this disease, though it sometimes follows tuberculosis. 7. Causes can include certain medications, sepsis, and bleeding into both adrenal glands. 1. 8. Addison's disease is generally diagnosed by blood tests, urine tests, and medical imaging. 1. Treatment involves replacing the absent or low hormones. 1. This involves taking a synthetic corticosteroid, such as hydrocortisone or fludrocortisone. 1. 2. These medications are typically taken orally. 1. Lifelong. Continuous steroid replacement therapy is required, with regular follow-up treatment and monitoring for other health problems which may occur. 9. A high-salt diet may also be useful in some people. 1. If symptoms worsen, an injection of corticosteroid is recommended. People need to carry a dose with them at all times. 1. Often, large amounts of intravenous fluids with the sugar dextrose are also required. 1. With appropriate treatment, the overall outcome is generally favorable. 10. And most people are able to lead a reasonably normal life. 11. Without treatment, an adrenal crisis can result in death. 1. Addison's disease affects about 9 to 14 per 100,000 people in the developed world. 1. 3. It occurs most frequently in middle-aged females. 1. The disease is named after Thomas Addison, a graduate of the University of Edinburgh Medical School, who first described the condition in 1855. 12. 13. Signs and symptoms. Edit. Hyperpigmentation is seen in a woman with Addison's disease. The symptoms of Addison's disease can develop over several months and resemble other medical conditions. 14. Most common symptoms are caused by low levels of hormones that would normally be produced by the adrenal glands. Low blood cortisol can cause a variety of symptoms, including fatigue, malaise, muscle and joint pain, reduced appetite, weight loss, and increased sensitivity to cold. 15. 14. Gastrointestinal symptoms such as nausea, abdominal pain, and vomiting are particularly common. 16. 14. Low aldosterone can cause affected people to crave salty foods, as well as develop low blood pressure that leads to dizziness upon standing. 16. In women, low dehydroepiandrosterone, DHEA, can result in dry and itchy skin, loss of armpit and pubic hair, and reduced sexual drive. 15. Young children with Addison's disease may have insufficient weight gain and recurrent infections. 15. Low cortisol also interferes with adrenocorticotropic hormone, ACTH, regulation, sometimes resulting in the darkening of the skin and mucous membranes, particularly in areas exposed to sun or regular friction. 14. Blood tests in people with Addison's disease often reveal low blood sodium. Many also have high blood potassium and/or high thyroid stimulating hormone, TSH. 14.